So my name is Miff Gay, and I am a clinician working in the Cognitive Dementia and Memory Service. And in that role, I'm a consultant. I provide advice on the management of patients with cognitive impairment in terms of assessment as well as treatment and managing complex behaviours.
So my role in aged care, I've worked in clinical and policy roles, and now I teach future speech pathologists about aged care and conduct research in communication disability in ageing.
So a typical day for me in aged care is seeing people with many different swallowing and communication presentations, a lot of them with neurological conditions and diseases, but also a lot without. And that's where I get to see a lot of our old friend presbyphagia. For a lot of these people living in aged care, I might be one of the only visitors that they get in the day, so they'd probably say I'm just popping in every now and then for a cup of tea and Vicky, but really we've been through a whole clinical swallow exam.
I love being a speech pathologist in aged care. You're never dealing with people who just have one condition, and a lot of being creative as to how you can get around their limitations and the skills that they have.
I love working in aged care. I think it's an area where there is a really amazing opportunity to make a difference for older Australians. I've always found aged care a really rewarding area to work in. I love hearing the stories of older people, and I think it's a real privilege to be able to give people the tools to express their choices, to engage socially with other people, and to participate in meaningful activities. From a clinical perspective, I think it's an area of practice which is really complex. Our clients have multiple health conditions, difficult social circumstances often, and so it can be a really challenging and engaging area of practice to work in.
I find it so rewarding working in aged care when I see the smiles of realisation and confidence that are proven evidence of success in breaking down communication barriers, whether that be a simple communication card that's going to reduce the frustration between the resident and the aged care staff.
Aged care is an area where I think speech pathologists are still really carving out their role, particularly with regards to communication. Communication underlies everything. It enables people to exercise autonomy, to make choices, to have engagement in meaningful activities. And so I think for speech pathologists there's enormous opportunity there to really improve the lives of older Australians.
We need more speech pathologists working in aged care in Australia. At the moment, we don't have the numbers to provide the level of care that we should be providing. There's so much that we can do in terms of restorative care for those who have a dementia or a cognitive impairment, in terms of functional maintenance, keeping people at home for longer, keeping people able to interact with their family for longer, but also just gives everyone much better quality of life.
I think we need more speech pathologists working in aged care. It's in the nature of our profession to advocate for people to receive the care that they need.